Welcome to The Bestie Perspective, a raw, unfiltered space where we explore the mind-body-spirit connection. Every week, we dive into personal growth, holistic healing, and life's ups and downs to inspire, support, and remind you you're never alone on this journey. Hey besties, welcome to another episode of The Bestie Perspective. I'm Eileen and I'm here with Lauren and Hannah, and I'm super excited about today's episode. We're going to do things a little differently today. I'm going to be shooting questions left and right for everyone listening to ponder as we discuss hospital versus holistic. Perhaps some of you have thought about the pros and cons of sticking to conventional medicine versus trying out alternative therapies. And honestly, there are important things to consider. Factors like scientific research, clinical trials, and regulatory approval. Those all come into play when considering anything medical. For some, an approach to care that aims to treat the whole person, mind, body, spirit, may feel more appropriate. There's safety, side effects, cost and accessibility, practitioner trust, and so much more to consider. Many people today look for integrative approaches that actually combine both systems. Will you be one of those people after listening today? Let's find out. Okay, ladies, so I wanted to start out with some comparison style questions. So let's start with, which do you trust more, natural remedies or prescription drugs, and why? So I actually want to start us off with this one because it got me thinking about a particular conversation, and I can't even exactly remember who. It was either a friend or a coworker. And I had asked her if she was into considering herbal medicine. It could have been in replacement of one of her medications that she was on or something. And she said, no, I just don't really know what they're putting in it. It just seems like, she had a fear of it not being as regulated as prescription drugs. And I posed to her a question in some way, shape, or form that was like, okay, but when you take your Tylenol pill or whatever and you break it in half and you see that white powder, do you trust what's all in that? Do you know exactly the process of how that was made? And I saw her face change and she was like, good point. So for me, I use both. I don't know that I fully trust long-term prescription drugs. I think that's a big red flag for me. And I like to see the green herb in a capsule that looks like a plant or, that kind of residue versus that, white cocaine powder that looks like all the pills.
I'm with you on there's always going to be room for both depending on what you're going through. Everyone has their own circumstances, but
right.
For me, I used to be like her, your coworker or friend or whoever you were talking to, because I was very impatient at one point. Like, I want to know I'm taking something that's going to work. There's a study behind it, and I don't have to wait. And I don't have to find out or test to see if it works on me. And then I started playing around with different things like different teas, different natural remedies like to help me sleep, which we can talk about later. But in general, like trying little things here and there more and more helped me gain trust in natural remedies. So I like to think that is a little bit easier on my body than some prescriptions, which is why I like to trust those even more. And also, I'm a little hippie too. So I'm like, if something came from the earth, I feel a little bit more connected to that, a little bit more crunchy.
I also like how you mentioned having to build trust with that. Because in a way, prescription stuff is what we're flooded with. All the commercials on TV, what doctors are giving out. And we don't hear a lot about the natural remedies. or the herbal medicine. And so I'm glad you pointed that out, because it is in a way something you do need to build trust with and see how your body reacts, especially because with natural stuff, you have a little bit more variety. Something that works for me might not work for you, or
True.
it may work for you, so I'm glad you mentioned that.
Mm-hmm. Yeah, good points.
And as far as me, especially when it comes to prescription drugs, I personally trust natural remedies more. And that's because I have a lot of sensitivities to medications. Like, I'm that person who, if there's a weird ass side effect, like, I'm gonna get it. So
this is so true, guys. Lauren has had the weirdest side effects. She's like, Hannah, I had a blood vessel in my eye burst and I went blind for a week. No, I'm just kidding.
Or like my earwax turned blue when I took a medication when I was a teenager.
Oh my God.
It's like the weirdest stuff. And so for me, that freaks me out a little bit, I mean, I know that there's always side effects, potential side effects, but I think looking at the side effects, either active, the ones that are known, where they're like, this will most likely give you nausea or gas or something like that. But then like the potential side effects, but also I think what I think about is the potential latent side effects. Okay, do we know how this is going to affect us in 25 years from now or 10 years from now? And then I also think that it puts you at more risk to get in that prescription loop once you start taking a prescription, because oftentimes you take a prescription, you start getting symptoms from that prescription. So then you need to take another prescription to help with the symptoms of that one. And then it just continues in that kind of cycle.
Yeah.
And I've also had a lot of really good success with natural stuff. So for me, it's like, I can take this one, pretty much guarantee I'm not going to have side effects, and it works, or I risk this whole cascade of bullshit that I don't know what's going to happen. So
Lauren's like, I don't want to turn purple and grow a tail.
Exactly. Because if it was a side effect potential, that shit would happen to me.
You'd think that Lauren went to the Willy Wonka chocolate factory, not the doctor's office.
That's so true, especially with the blue earwax. That sounds like some shit.
Right? Oh, goodness. She also got vertigo and ringing in the ears. Oh, my goodness. This girl has had some fun stuff pop up for her.
Yeah, so I usually don't sway in that direction, because when I do, ends up funky.
Well, then, have you ever tried, Lauren, a holistic treatment that worked better than conventional medicine?
Yes, I have. So something else that I've been prone to in my 20s, I would say, because it started young 20s, but muscle spasms in my neck. And the first time it ever happened, I was actually prescribed Valium, which at the time I was in nursing school and I was like, oh shit, Valium? I'm taking a controlled substance for this?
Right.
So that was a little shocking to me. And even since then, I've been prescribed Flexeril, which is another muscle relaxer. They're both muscle relaxers, but Flexeril is not a controlled substance like Valium. And what I noticed with those is I had side effects, right? It took long to work, actually, in my opinion. I think sometimes we also think, I'm going to take that prescription and boom, it's going to work. And actually, it took a while, a longer while than I was expecting. But then it also made me groggy and super tired. And it was kind of like, oh, if you're taking this, you can't go about your day. It's really just cutting things off. You've got to go to sleep. You can't drive a vehicle, all these things. And I ended up finding a natural muscle relaxer called Formula 303. And it has magnesium and valerian root and, just all natural herbs in it, along with magnesium. Yeah. And I pay more attention to my body now, because the first time it ever happened, of course, it felt like it was out of the blue. But now I can kind of feel it coming on a little bit in my neck. And once I feel that, I take this natural muscle relaxer, and it usually works 99% of the time. And I have no side effects, no grogginess. I'm able to live my life.
Nice.
So that's been my experience with holistic versus conventional for an issue that I've had come up several times in my life.
Nice. Say the name again for anyone else that's dealing with
It's
that.
called Formula 303. And you can use it not only for muscle spasms, but any soreness. Like if you have a day where you're working out in the yard, for example, and you're like, damn, I'm going to be sore tomorrow, or even a hard workout, you can actually take it, that day so that you wake up less sore the next day. So
okay, like a preventative. I like that.
Yeah. So whether you're in the heat of a muscle spasm, you'd obviously take more of them. But if it's just soreness or something like that, you can take it. So Formula 303, I believe you can find it on Amazon. So,
and she's not an affiliate, guys. It's a legit recommendation. Yeah.
Where did you originally hear about that? I have never heard of that before.
My chiropractor's office, actually.
Nice.
I was talking to the receptionist one day, and I think I was just sharing my experience because I was having a bout of it, and I ended up going into the chiropractor, and she was like, have you ever tried Formula 303? It's amazing. And I was like, no, I've never heard of this. And of course, I had to buy it right then and there because I was like, I have to try it and see if this works. And she was right. It totally works. Mm-hmm.
I'm going to remember it too for myself, just in case.
It's great to have on hand. Like you said, the preventative aspect, I'm kind of one who, now that I know the natural things that work for me, I like to have, Formula 303 on hand.
Just in case. Yeah.
Just in case. Or I travel with it because I'm like, hey, you don't know if you're going to sleep weird on a pillow or something and have your body act up. So it's one that I just keep with me.
The just in case cabinet versus the medicine cabinet.
Exactly.
Hannah, do you have a holistic treatment you want to share?
Okay, so two come to mind for me. One is for period cramps and lots of period symptoms. I have dealt with this for my whole life almost, and I've gone through waves, eras of the symptoms not being so bad, and then sometimes it is rough. And especially when I first started having my period, just to give you guys some background into how serious this was for me, I couldn't go to school, or sometimes my mom would have to pick me up because I was hurtled over so hard. I know even some girls struggle with throwing up from cramps. So,
yeah.
And other symptoms too, but something that changed my life. I used to rely on ibuprofen every month. That was the only thing that could get me through. And even that would take a little while. And I had to sleep and let the ibuprofen do its thing for at least 2 hours was when I finally started to feel the relief where I could function again. And my holistic alternative that I have found later in life is magnesium, a game changer for my cramps, and lavender, rubbing lavender right on over my uterus. And I still rest. If time allows, if the day allows, I will rest. I consider that natural as well. And then also Lauren gifted me with a tea from Tea Rabbits in Dahlonega, Georgia. So I'm going to plug them because they make this wonderful tea called OK Vajayjay.
Yes.
Okay, Vajayjay.
Yes.
I just drank some today, actually.
Well, and I don't drink that specific one, but all the elements of it, I've kind of made one similar for myself at home. And yeah, it's such a good combo.
Yes, it tastes so good too. So it has ingredients. Is it Rooibos tea? Rooibos?
Rooibos?
I don't know if it's a typo on their website. I looked it up.
Something like that.
How do you
I always pronounce it wrong.
I think it's Rooibos. I'm not 100%. Listeners, comment if you know how to say it.
Right.
Okay, so the ingredients are Rooibos tea, raspberry green tea, jasmine chunhao tea, lemon balm, chamomile flowers, fennel seed, raspberry leaves, and a sprinkle of magic and lots of love. So, all of that good stuff. That has been amazing for helping my period cramps. and overall period symptoms, mood, and everything. My second holistic alternative is for anyone who takes stimulants for ADHD who maybe does not want to anymore or is curious to know what else you could try. Because I personally couldn't tolerate Vyvanse. I was taking Vyvanse and everything was going wrong with that. One of my favorite things I found to take, especially at night, is magnesium L-threonate, since we're on the topic of magnesium already. And that one I feel like has specifically helped me because I struggle with a dysregulated nervous system. And so working on regulating that has been a holistic alternative to help with ADHD and getting adequate sleep at night that feels really, truly restful and calming my overactive mind. Because that type of magnesium is sometimes nicknamed neuromag because it crosses the blood-brain barrier. And that is me, 100% overactive mind. So I have found that that really helps me with my ADHD, along with some other things, just like mindfulness, meditations, and moving my body.
Did you find that out on your own?
No, I did not. I actually had nurse coaching friends recommend it to me.
Okay. So
I want to
this
try this.
kind of right. But it does just a great segue to another question. Do you think doctors should recommend alternative therapies alongside medication? Because this is one example where you found something that worked better than a medication that a doctor, I'm assuming, Vyvanse, you didn't get off the street, that a doctor prescribed it to you.
Definitely not. And I'm pretty sure that drug is illegal here in DR.
Oh my God.
How interesting. I did not know it was illegal. Okay, there's a lot of stuff that the U.S. uses that's not allowed in other countries. So there you go.
I
scary.
need to fact myself on that, but I'm pretty sure it's illegal.
Oh, wow.
Wow.
But yeah, then I pose that question to you.
I definitely do. I know it can be difficult for doctors because it maybe isn't in their system of things to check from. There's lots of presets when it comes to discharge paperwork after seeing a patient for a primary care visit. Okay, make sure you're getting outside to do moderate exercise 3 times a week for at least 30 minutes, or yeah, I'm making that up, but I don't know exactly what they have in there nowadays, but it's not very personalized to that person, mind, body, spirit wise, because you might tell them to do something like that, but are you considering that maybe their mom just died? And if they tend to that, maybe that's the priority right now. And, just being able to recommend many things among that and give the time and energy towards that versus just selecting from a box on a computer based on what their chronic conditions are.
Yeah. It sounds like widen the lens, basically, of recommendations. To me, it also gives the patient some power back.
Yeah.
In that you have options here. And as well as we all know that doctors do get kickbacks. There's those pamphlets that they go to very regularly on the wall for a reason. That's got its nice little pamphlet cubby.
I know what you mean.
Right? You've seen it on the wall of the doctor's office, I'm sure. But yeah, I think having other options, and some of the ones that don't even cost money, just to let the patient know, that autonomy makes them feel capable and powerful. And I think you need more of that in health.
Definitely.
Absolutely.
I was thinking about empowerment too, but also it made me think about the opportunity for education that's there.
Yeah.
I remember in another episode, Eileen, you had shared that you just took a couple minutes, right, to explain to that little girl and her family why she couldn't eat, what was happening with her liver and her body. And a couple minutes of that education made such a difference for the girl, her family, their day, their experience. And that's what I think of when it comes to recommending alternative therapies. Like, you can take that 1 second or that couple minutes to provide a little bit of education. And like you said, it empowers them to make the decision for what they feel is best for themselves.
Yeah.
And their journey. And
exactly right.
And there can also be so much great synergy, I think, between holistic modalities and modern medicine that can actually make or actually provide even better results by
Right.
combining. So it's almost like you're missing out on a portion. You know what I mean?
Exactly. Like, if you had to choose one approach to your health, the next question is holistic or conventional. My answer would actually be, I don't know that I would. I think it depends. The following question: how do you decide whether a health issue needs a doctor or a more natural approach? I think if you're in an emergent situation and in trauma or anything, Western medicine has got it down. I mean, you need a surgery, you need something. I feel like intensive care and emergent care, it's great. But when it comes to preventative, even long-term stuff, I would actually lean more towards holistic alternatives. So yeah, what about you guys? Are you down for one or the other specifically, or you also think there's different reasons that would make you decide to go a different route each time, depending?
Yeah.
I giggled a little bit because I'm on the same train as you, Eileen. The response that came right to me after you asked that question is, well, are you dying or no?
Okay, that Dominican Republic mentality.
So there's lots of tests and things and labs that doctors do nowadays to assess where you're at with your health. Like the likelihood of you having a heart attack, I know, is a test that they do. So if your test results or your lab results are coming back really high and kind of worrisome for you, maybe you want the prescription stuff to help, or you want more modern medicine to help you while you're working on your health. But I think the goal should always be to never have to rely on it long term. At least that's my perspective, is to not use it for your whole life, because at some point there's going to be a plateau in your health and the medicine's not going to be helping anymore if you never changed the thing that started to hurt you in the first place. Eventually, that
Right.
one's going to creep up and start to throw more weight on that dose of medicine you're taking. And that's kind of
Yeah.
how I've always seen that.
Yeah. Are you on the same wavelength, Lauren?
Yeah, I was going to say, I'm with you girls with that. And I think where my mind took me was also the acute versus chronic.
Mm-hmm.
You know, I see Western medicine a lot as a Band-Aid, right? Instead of looking at root cause. So it's like, oh, if you're in a car accident, a traumatic car accident, you need the Band-Aid, right? Like, you need to not die. Or if you have
maybe
a heart
some
attack.
stitches under the Band-Aid. Yeah.
Right. If you have a heart attack, you need that Band-Aid approach, that quick fix, because it's going to keep you alive. But then I think when it comes to, long-term issues, chronic issues, you actually want to get to the root of those problems. Because like Hannah said, if you just cover it with that Band-Aid and you're on that medication, you are going to plateau at some point if you never change what needs to be changed for whatever the root cause is for the issue. So I am definitely on board with that. And even if I have not something that's like a traumatic thing happen, but say just a new thing pop up for me, I actually, something I tell myself is I have this little like 2-week rule that I give myself. And basically, if I can't heal or fix whatever it is in 2 weeks with natural remedies, holistic approaches, then I consider consulting a doctor. Because at that point, for most acute things that come up that are non-emergent, if you can't solve it in that time, then usually in my experience, okay, maybe a time to consult a doctor. But honestly, most of the time, I never need to consult the doctor. I can usually always solve it within 2 weeks. It's pretty rare. But I feel like a lot of times we don't give ourselves that opportunity. It's just, oh my God, this happened. I need to go to the doctor. Like I've known people like that where it's like they immediately have to run out to the doctor. And it's like, our bodies have such capacity for healing. Like if you just give yourself a minute, you know, you might not need to be flooded with all these medications that they're probably just going to dump on you.
So yeah, let's say you go to the doctor for something then that is non-emergent.
Mm-hmm.
Have you ever felt dismissed by a doctor when bringing up alternative treatments? Like if they're not the ones suggesting, we've obviously said they should more often, but have you ever brought up something?
So I would say one of the things that sticks out to me in that situation isn't necessarily a Western medicine doctor. It was actually my chiropractor.
Okay.
I've probably mentioned this in other podcasts, but I've dealt with chronic back pain for 10 years. I know you girls know that. And when I had a flare up about 5 or 6 months ago, I was actually trying to brainstorm with my chiropractor about other options just to assist in my healing and recovery. Physical therapy, I mentioned stem cell injections, things along those lines. And he basically either said, I don't know, as far as anything else to try, or dismissed the other options saying, oh, you could do stretches and exercises without a PT, and there's not enough research about stem cells, you know, that kind of thing. And I remember just feeling like he was just shooting down my ideas. Like I was trying to be I was in so much pain and I was just trying to be optimistic, trying to like work with him, brainstorm to see I'm down to do other things along with chiropractic care to improve this healing process. But I just felt like he had nothing else to offer, but just keep coming back for adjustments. He didn't really know what else to tell me. So that felt dismissive to me.
It's funny you say that. I've had that experience as well with a chiropractor too. It's like if you're outside of their realm, they can't join you. Even in a conversation.
Right.
Yeah. Your curiosity was not matched.
Yes. And for me too, I was thinking in my head, I was like, oh, just like as nurses, we have to keep up with, you know, continuing education and stuff. I assume it's the same for chiropractors and whatnot. So I was trying to open this conversation thinking maybe he's heard of stem cell shots directly to the area or some other therapy that we could combine with our adjustments to get better results. And he was just like, I don't know, or shot down the results that the ideas that I had. And yeah, that just made me feel really dismissed. Like I was trying to co-create something together and it just felt like he was like, that was the energy of it, you know?
Yeah. And I know you're not alone in that because there's got to be so many people. Eileen said she had a similar experience with a chiropractor, but even with any doctor, I think nurses are guilty of this too. So I don't want to just pin this on just doctors, but I've worked with nurses who also, you know, I came from the ICU. So we were like super other end of the spectrum.
Yes. True.
T's were not going to help people, you know, who were at that point. But
well, and I did have an OBGYN that I had asked, could we check my hormones because I had fibroids? And she looked at me like, oh, why would I want to do that? Like, we knew you were pregnant, so you did have high estrogen, and that can contribute, to fibroids. And she just went on a whole spiel of talking to me like I was a 2-year-old that didn't know what fibroids were. She had assumed, I guess, that I don't think she even knows that I'm a nurse. Like, there wasn't background or anything in our conversation at all. And she was just very dismissive is the perfect word. And so thankfully I did go check just to be certain. And there wasn't anything wrong with my hormones for whatever basic testing that I got done. But why not just check? If I'm willing to pay the money and I'm asking for you, but how ridiculous. How would I possibly want hormones checked when there's an issue? Yeah.
I remember you and I having a conversation like shortly after that happened to you. And I was so frustrated for you because it just felt like she was trying to make you feel crazy for wanting to be preventative. Like,
Mhm.
oh, we'll wait till something shows up. No,
Yeah.
you're like, I'm trying to like be preventative with this and make sure I'm in a good place right now. I don't want to
Yeah.
wait until something happens.
Yes. It's like I gotta be bleeding out and half falling over before you want to do something. So wrong on so many levels.
Something that keeps popping back into my head as we keep talking about all of this during the conversation is a lot of times when I go to the doctor or I'm talking to a nurse with those curious questions like you did to your chiropractor, Lauren, of could I try this? Have you heard of this? What about this? If it's not a prescription or a treatment that is listed from the system, a lot of times they have not tried it. They don't know the research behind it.
Mhm.
They are so overworked and busy in their own career and personal life that how could they confidently answer yes or no? They wouldn't want to do you wrong, so they err on the side of safety because they're working under a license. You have to remember that when you're talking to someone about complementary and alternative modalities. So I think about that too when I'm at the doctor asking those questions. Like maybe they've tried it, but I'm not banking on it based on how I'm feeling in this conversation. And
Yeah.
I had that experience also at an OBGYN island, not asking about fibroids, but that is where I felt dismissed because
Mm.
this was before natural cycles and that whole app and system was popular. I was asking about alternatives to birth control besides just condoms because
Okay.
I was experiencing a whole slew of side effects from birth control. It was not controlling my acne. My moods were all over the place. It was the first time I ever felt suicidal in my life.
Mm. Mhm.
And when I stopped taking the medication, those symptoms stopped immediately, but I didn't have birth control anymore. But, anyways, I bring up these questions to my OBGYN and I'm wondering, is there any way to naturally prevent pregnancy? I mean, there's got to be more to the science behind this. Like, people have to try to get pregnant, don't they? So, how do I try to not get pregnant? And since then, there's been a whole new side of the internet open up about like track your ovulation days, like
Yeah.
don't have sex on your ovulation days. And
Mhm.
there's even apps that natural cycles, and there's probably others too, but that's just the one that comes to mind where you're tracking your temperature, or you can wear
Yeah.
your aura ring and have it, even more accurate that way. And I have a friend who that has worked for them. And they just finally decided to get pregnant a few months ago. I'm so happy for them.
Aw.
Oh,
Um,
Yay.
and that has also worked for me. I don't even take my temperature or anything like that. I just track my ovulation, and me and Jason have been together for over 6 years, and I have not gotten pregnant, and I have not taken
Awesome.
birth control. And we don't use condoms. Like, I'm just being real for people out there
Yeah.
so you can hear a real story of like, oh my God, I'm so scared to get pregnant. Like,
Yeah.
I have to use this or I have to use that.
So Eddie will claim that the ovulation tracking doesn't work because that's what I was on when we had Elena, but it's my fault. I will explain further. Yes.
Tell me.
So,
This is so funny.
yes. So I was off. I was pretty regular, and I think I was late for a couple of days while I was in Florida fostering my nephew. So when I got back all excited with Eddie, I don't think I had the specific day lined up correctly. And so he was like, wait, are we good? Are we in the free zone here? Are we in the safe zone? And I had said yes. So once I found out I was pregnant, I went back and tracked and I was like, oh, crud. I was slightly off because of the stress, I think, of the family situation.
Yeah.
It shifted my period a little bit. And so, in all fairness, it worked for an entire year, sir.
And you should just be like, and babe, I was just horny to see you. Okay.
It had been a while, okay? No. So he claims that I got us pregnant on purpose, which is false.
It was meant to be.
I know.
Yes. But yeah, so I just following up that to say, I asked my doctor about that and she looked at me like I was crazy and said, that's not possible. And then proceeded to show me, what are those insert devices called again?
The diaphragms?
The IUDs.
Okay.
Yes. She proceeded to show me 3 pamphlets about IUDs. And I was like, I don't want to do that. What are my other options?
Yeah.
Oh my gosh.
So that was the end of my story.
Well, I know we've already mentioned some holistic practices. Before we move on, is there any one that stands out to you guys that you hadn't mentioned that you tried and it did help?
I think something for me, other than taking herbs orally, would be my first experience with acupuncture.
Mm-hmm.
So,
I loved it for myself too.
Yes. So this was actually a couple years ago. It was 2 months before my wedding, which I know y'all remember this time because I was like, no, my back. But I threw out my back. It was one of the worst throwouts that I've had with my back. And dealing with chronic pain, any of our listeners, if you're a chronic pain person, you know that you have a higher tolerance. So when you're rating pain and you're actually saying you're in a 10 out of 10, you are in so much pain. And it's really rare that I actually rate myself a 10 out of 10. And this was that. It woke me up out of my sleep. I took 2 Aleve. Nothing was even taking the edge off. And I was frantic almost because my chiropractor was closed that day. And I was just on my phone like, anything. And I was like, wait, I've heard of acupuncture before. Let me just see. At this point, I was like, I am willing to try anything. Not that I had anything against acupuncture, but I just had never tried it. And I found an acupuncture spot with great reviews. I called them as soon as they opened because, again, I was woken up so early. And got in, did my consultation, and literally just after the acupuncture, it had already brought me down from a 10 out of 10 to a 7 out of 10, which was huge because I wasn't getting any relief at all. I mean, again, I took 2 Aleve and nothing was even taking the edge off of the pain. I couldn't get comfortable because sometimes with my back, I can like get into some contortion or position and it'll take some pain off or give me relief, but like nothing was working. So the fact that I went to acupuncture immediately after, I had already gone down 3 numbers on the pain scale. So to me, that was already huge. And it was only an hour or hour and a half or so. And then my practitioner also reminded me about earthing, grounding again. And we can get more into that in another episode.
That's what I was going to say, because I remember you wearing a grounding bracelet right after this. And we had all come over to do crafts. We did our shoe bedazzling together.
Yes.
I remember.
So for those listeners who don't know about earthing, also sometimes used as grounding, it's without any of the actual bracelets or any of the tricks of the trade that people use now. It's standing on Mother Earth, whether it's the dirt, the ground, the grass, the beach, barefoot.
Yes, exactly. And we'll have to do an episode on that because it's so fascinating.
Oh my gosh, yeah. We just got an episode idea.
Right? And so I had heard about this before, but one of those things that just kind of slid into the back of my mind. So after he told me, I was like, oh, I think I have a grounding bracelet. That's right. And so after I got back from my appointment, I put on the grounding bracelet, and within a couple hours of grounding post acupuncture, I was at a 4 out of 10 in that
Nice.
same night. So I went from a 10 out of 10 to a 4 out of 10 without conventional medicine.
Awesome.
And that was an incredible experience for me because that was one of the most painful flare-ups that I had with my back.
Thank you for sharing. I feel like someone out there is going to need to hear this that maybe feels disappointed or, just like they're losing hope and they're not going to find anything.
Yeah,
Right.
It's not
Whether
true.
that's with chronic pain or anything.
absolutely. So do your research, though. Find someone credible and well-reviewed because that
Yes.
certainly matters. But when you find that right person, it's awesome. And
Yes.
and sometimes my practitioner, for example, he was also trained in Chinese herbal medicine. So he was even able to give me recommendations for that on the side. So it was a great
Awesome.
experience.
Yes, and just to clarify, listeners, any of what we're sharing today is not recommendations, perhaps suggestions. We want to be informing you of our experiences, of course, but we are not medically advising in any way. So, have you guys had a bad experience with either, whether it be holistic or mainstream medicine? And do you have a story to share what happened? Because I got a juicy one. So
Why
I
don't-
can.
Let's
Yeah.
hear your juicy
Let's
one. Because
hear your
really,
story.
like, my worst one, it was the gyno who was just like, no, here's what I
Okay.
have, and that's it.
Okay. So, and to be honest, I'm going to use the name of this place because I do think that it's important for change. And if somebody who works there happens to fall upon this episode, I'm at the point where I think I'm very okay with them contacting me to try to mend or repair my tainted experience, to be honest.
But
So-
first, they need to watch the How to Fuck Up Better and give you a gold standard apology.
That's right. That's right. And, I could have taken the time to actually file a formal complaint, but I had a newborn and after so much time, I ended up, it felt like it was too far along. But this was at WellStar. And for those who do know the name, there have been, unfortunately, bad stories with the WellStar hospital system. I will say, though, that the WellStar North Fulton delivery area was amazing and separate from the hospital standards. And I will highly recommend anyone in Georgia looking for a midwifery approach. They listened to women and they were incredible. And I do not want them to fall with this story should this get out one day. But I went to the WellStar emergency room because I was having high blood pressures. My placenta did not detach, and so I had it manually removed. Thankfully, did not have to go to the OR for it, but it left pieces, and that ended up being the problem. But they did not know this. I mean, they knew that happened, but WellStar, when I got there, took my blood pressure, and it was the top number was 135. For those who don't know or aren't medical and listening, normal blood pressure is 120/80, but standards in America have actually been on the rise. A lot of people tolerate higher blood pressures nowadays, but my norm is 100/70, sometimes even 60s or low 100s, 110. I at home got to 150. And I called my OB on-call person, and they said, check it 3 times in a row. If it's above 140, we need you to come in. So I did. I, tried to relax. I tried to, make sure that I was as calm as possible and resting position and taking the 3 blood pressures and spreading out the time. Nope. So sure enough, we go in. And because it was normal for their standards, I told them I was usually 100/70, but 135/90 something is what they got from me. And they were just like, well, it seems normal now. And I told them, no, this is my norm. Even through pregnancy, the highest I got to was 120/80. And I said, that's not my norm. And I said, even so, I got higher at home. I'm feeling better right now, but I was told to come in. okay, we'll run some tests. They checked me for preeclampsia and whatnot. And thankfully, I had another episode in the lobby because when I went back, and that blood pressure was, the top number was 168.
Holy crap.
When I
That is so high for you.
Oh my gosh.
Girl.
It's
could
high
not
in general.
function. I couldn't breathe. I couldn't talk. I was twitching with every pump of my heart. And they're like, what's wrong? What's wrong? And when I went back, it was as if I had anxiety, like, please just try to calm down, try to breathe. I was slowing my breath down, but because of my heart pumping out of my chest, it looked like I was hyperventilating. I was not. I was inhale, 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 exhale, 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 exhale. So to them, it just looked like, right? From the outside looking in. So, but calm down. It's hard to bounce back from a baby. That's what the female, let alone female doctor told me. It's hard, it's tough. It's this and that. Is there anything else going on even? Have you been anxious? Have you this and that? And I am sitting here
trying not to die. Like, damn.
Yes.
With physical symptoms.
So they were going to send me home. And thankfully, I spoke up for myself. My husband spoke up. He's like, look, she's a nurse and we've been fostering our nephew. This isn't like I'm a new mom and I'm stressed and I'm anxious. I trust her with my daughter more than I trust myself. And so we really had to vouch for her. And she
husband.
Finally, I know. She finally ended up, the doctor said, we'll do some serial blood pressures and whatnot. But it was just, she was still just kind of like, I'm not so sure. Thankfully, there in the back, I believe it was 173. And that is stroke levels. To anyone listening, Wellstar did me wrong. That is unsafe. And they should never do this to anyone else. That is not okay. If anything, I really appreciate the breastfeeding consultant in the Atlanta area, that number that I called. She even said, I am so sorry that happened to you, after I told her in kind of just checking in for breastfeeding issues. She said, this is why the postpartum death rate for women is so high in Georgia. So I am putting the name out there. I want women to speak up for themselves. I want that to not happen to anyone ever again. Thankfully, with that 170 plus blood pressure, they gave me labetalol. It's not like I was trying to get some blood pressure medicine.
Right. You'd at least be trying for something fun.
You probably needed that labetalol when your blood pressure hit 150.
Yeah.
Exactly.
Like, what for you and your normal, your threshold for having a stroke may be lower than someone else who meets the standard.
No, but she flat out told me, we can't adjust our standards based on the individual. She flat out said that.
What?
Yeah.
She flat out said, we can't, that they have their policy threshold of when they can prescribe labetalol. Well, I'm pretty fucking sure 170 is perfectly fine, if not less than that. Wow. So I was beyond done. Thankfully, they did give me the labetalol. And once I passed those clots, it was maybe just only 2 weeks that I needed it. And I was good. So it was a very, very scary situation. I felt like I was dying or having a heart attack or something. And they were wanting to. And I know I'm not alone in this when it comes to it being a woman. They were blaming it on anxiety.
And calm down. And then don't I remember you telling me, because I remember you telling me this, and I was, even now hearing it again, I'm still frustrated at the medical system.
It turns you up inside a little bit.
It frustrates me, but I also remembered you telling me that they maybe even gave you something else, and then the nurse or whoever came in had said, oh, like, I see that you're calm now, or something like that, right?
Yes.
And then
they
acting like you were just calming down, but it was actually the medicine they gave you.
It may have been Xanax, but my respirations it was low because It wasn't my respirations. Yeah,
Yeah.
it was low. I was just like, yeah, I bet I'm relaxed now. That's not what I needed. They gave me something because they were just so certain I had anxiety.
But it's like
Oh my
still making
gosh.
you almost feel crazy, or, oh, you were just being anxious and nervous and whatever. Even after they had to give you the labetalol,
Yeah.
they were still coming in like, oh, you're calm now. Oh, good. You're not anxious anymore. And it's like, no, you
Freaking-
idiots. The medication worked. That's why I'm calm.
Yeah. Yeah. The medicines kicked in,
Mhm.
dumbass.
Thank God you knew you're normal so that you could
Yeah.
advocate for yourself as much as you needed to. And
But-
like, you know, to be able to explain that to your husband too. So while you were in the midst of an episode, he could continue to advocate for you.
But the fact you had to work so hard, that's what bothers me too. Like, we've talked about already how when any of us aren't well, we're worse at taking care of ourselves. So the fact that you were going through that, literally breathing in that way because your body was doing what it was doing, and you still had to advocate for yourself.
Yes. And it scares me to think, like Hannah is mentioning, what if it's someone that doesn't even know they're normal? Oh, the doctor's saying
Right.
I'm normal, so I guess I got to listen to the doctor. How many people do that? How many people go alone because they have no one else? Thank God I had my husband who could talk while I couldn't.
Right.
It's no surprise that people die when they go to the hospital.
Just
Yeah.
Sadly to say.
being gaslit by them. Oh, I guess I'm fine. Maybe I am just being an anxious new mom. Who knows what story the women will take on to even console themselves in the situation after
Sure.
being
Oh,
told this, right?
I literally did question when we first got there. It was like, was it anxiety? But thankfully, I stuck to my guns because they did not find preeclampsia or anything else. And when I went and followed up with my OB, then we connected the dots with there is some residual stuff left in your uterus from the placenta. Okay. So maybe once that passes, my blood pressure will normalize. And then that's exactly what happened a few weeks later. So I know that I'm not alone in this scary story. And this is where some people are turning more holistic or to other people rather than the typical doctor's office scenario because they've been deterred from a negative experience. So I do hope that we can bridge the gap between the two. So, to move on after that unsettling reliving moment, do you believe the mind plays a bigger role in healing than medicine?
Oh, yes. I definitely think so. I mean, people have, and we've talked about this before, people have literally healed injuries and parts of their body with just their minds. I know we've mentioned Dr. Joe Dispenza on a
Yes.
previous episode, how he literally broke his back and shattered multiple vertebrae, and he was able to heal himself with his mind.
Yeah.
And
And even cancer patients making tumors
Mhm.
disappear. Like,
absolutely.
so many stories.
Yeah, I think it plays into why these, like, quote, miracles exist, right? That go maybe against conventional science. And I also think the placebo effect is a thing for a reason. And I think it
Yeah.
just proves that point even more, that our mindset truly affects our healing. I really do believe that people who have a more negative outlook, for example, often do worse than people who have a positive outlook. You even hear people say, oh, before you go into surgery, about how your mindset's important and how you go in and how you pull through and even how you wake up. Actually, as an OR nurse, that's something that I saw, was if somebody went to bed really crying or really upset, really sobbing, and I say went to bed, but, got put under anesthesia.
Gotcha.
When they woke up, yeah, I'm sorry. When they were woken up from the anesthesia after surgery, they would often wake up swinging arms and craziness and all this, right? And so as an OR nurse, something that I tried to do was help them gain calmness before going under anesthesia. I would hold their hand. I would guide them through breath work because I believe in the importance of how you go under. And I think that's with anything, not just surgeries, but I mean, I've seen it myself in surgeries in that kind of way. But yeah, then hearing these stories, Joe Dispenza, people reversing incurable terminal cancer. I mean, all these incredible stories, I really do feel our mindset plays a huge role.
Definitely. One term that you just made me think of, I heard one time, is helping people reach their healing potential. Like everyone has different healing potentials, I think, based on where their perception is at, where their mind is at. And in the hospital, I think a lot of times people's perceptions are narrowed, shot down, strangled a little bit even.
And stomped on the floor. No.
Because that is just how that system is set up. For Eileen, she knew she probably needed that labetalol way earlier than getting a blood pressure of the 170s because of where her normal is at. But because of the hospital policies, they were unable to provide her with that. Even if that doctor was thinking, maybe I should do this, like in order to not get in trouble with anybody or her license or the hospital, she did not provide that to Eileen and put Eileen's life at risk.
Absolutely.
There's not room for like play and I'm just bringing that example to say there's not room for playing in some gray area of like, okay, let's say this patient really does know themselves very well. How do I even assess for that as a provider? And how can I trust my patient? I know what my patient's talking about, right? There's so many things to consider as a provider, but if you let your patient play their role, if you let them reach their healing potential, let their mind be a role in it. Don't just gaslight them about their problems.
Yeah, make it a dance versus drag by the foot.
You remind me of that video trend that's going around of like, I woke up in a new Bugatti.
New Bugatti. Yes, and then my head hit the floor. So cute. Well, yeah. So with that, though, I would love for us to answer, what does wellness mean to you? We've spoken on the ups and downs of our journey, but, does it include a doctor's office? What is that definition for you guys?
I know we mentioned prevention today, and I definitely believe in prevention. So I feel like that part includes the doctor's office for me, getting physical screenings, checkups to just stay informed and aware of what's going on with my body, of maybe even things that I can't see visually or even feel necessarily, and getting that snapshot and that picture so that I can take the holistic steps to prevent things from advancing or developing. So that's how I see the doctor's office role in my wellness. But for me, I think that wellness means just overall vitality and health of the whole person. Looking at mind, body, spirit, emotion, and feeling healthy and thriving in all those areas. That's what wellness means to me.
And that's honestly exactly what I was going to say with the thriving, not surviving being the key word. Wellness is thriving, not surviving. It's freedom and capability, not dependency on unnecessary means. Now, I will say with healthcare and children, and especially in seeing physical injury, supportive devices like wheelchair, crutches, there are situations where a person cannot live without the medical device or something like that. And so that's where it has its place. I've taken care of thousands of kids at this point who've needed feeding tubes, ports, catheters, all kinds of things. And it would be absolutely amazing to see them live better with that medical support. So there's no denying that conventional medicine has its place. It's as long as it's assisting you in that thriving.
Yes.
What about wellness for you, Hannah?
So wellness to me, it does include the doctor's office for the same reasons you guys mentioned, but also your mind is a big one for me too. Mind, body, spirit, emotional, all of that together, but especially the mind. Because for me, a lot of my survival mentality, a lot of my suffering was just that. It was a mentality. And how I was going through life with a super dysregulated nervous system and really negative, bitchy voice in my head. Once I got that under control, I was able to enjoy and thrive and feel good and enjoy my life a little bit more.
I love that. Encompassing the whole, cannot leave the mind and doing that. Awesome. Well, besties, we hope today's topic has inspired you to start asking even more questions and defining your perspective on wellness, treatment, health, and what these things should look like for you. Again, we remind you guys this isn't medical advice today. We just wanted to share our experiences and want to assist you in your journey and give you the freedom to explore more. So while in some ways conventional medicine offers faster, more targeted relief, holistic therapies often involve lifestyle changes, ongoing sessions, diet or exercise changes. And sometimes they can feel more involved and therefore more of a hassle. Doctors can seem like experts, but sometimes be seen as impersonal or rushed. Holistic practitioners do tend to spend more time with patients and focus on the whole person, yet might not be properly licensed or qualified. So do not feel alone if you have uncertainty about which method is best. Gather information, branch out, and expand your research, and have open communication between all providers if you do choose to create a medical plan that combines different methods. Reach out to us if you have more to share. Click on our link tree, find us on social media, YouTube, all the things. Like, share, comment, and follow if you like what we're dishing out. Join us in our next episode where we hone in on one holistic tool in particular, cacao. Never heard of using cacao as medicine? Or if you have and want to learn more, then tune in. Lauren leads us in the topic, all things cacao, benefits, ceremonies, and our experiences. Until then, besties, keep growing, keep glowing, and always trust in your own bestie perspective.